Hello people, this is Dr. Muskaan this side, and today I'm going to discuss one case. It is an autoimmune disease and it is all about systemic lupus erythematosus. When I was asked to make the list of all the symptoms which are present in this disease system wise, like these are cardiopulmonary manifestations, these are renal manifestations, these are general manifestations, these are neuro manifestations, I have just made a big list of all the symptoms which should be there in the patient, and I have just did take cross. So this is also a very nice way when we are in a practicing stage. So I want to share this case with you all. Systemic lupus erythematosus is autoimmune disease, and uh, in this, family history was positive when I have gone near patient. Means same disease was in her parents, both father and mother. Okay, so first of all, I have appreciated butterfly shaped rashes on the face of the patient. Like from here to here, it was completely red like this. Okay. Second, erythema was there. It was completely red. Third, pedal edema was present. Fourth, patchy alopecia was there. Patchy alopecia means hairs are not present at some part of her head. And she was young female, 17 years old only. Raynaud's phenomena was absent. What is Raynaud's phenomena? Bluish discoloration is present in that. Livedo reticularis was absent. What is livedo reticularis? Livedo reticularis is cyanotic mottling of the skin with fishnet or reticulated appearance. You just go to Google Baba and write livedo reticularis and just see its picture. पूरा जो leg होता है ना उस पे red patches होते हैं, but in the fish like pattern. ठीक है. Periungual erythema was absent. Urticaria was absent. Arthritis was present. She was complaining that her joint pain is present. Fever was present. Nausea, vomiting was absent. Pleurisy, bilateral exudate, that was present. CNS abnormalities were absent. Lymphadenopathy was absent. Okay, now cardiopulmonary this was general all the features which I have seen. Now I am going system wise, first of all to the cardiopulmonary involvement in SLE patient. So there are 6 features which are generally found in SLE patient. Pericarditis, myocarditis, arrhythmia, heart block, ischemia, heart disease, lupus pneumonitis, shrinking lung syndrome, and 6 is your PAH, that is pulmonary artery hypertension, and ARDS. Okay. So how I have seen all these features. First of all, telling you about pericarditis and myocarditis. In that, how I've seen it is present. Chest pain was present in that. Shortness of breath was not there. Fever was there. Tachycardia was there. Tachypnea was there. Sweating was not there. So there were symptoms present which were leading us that हाँ pericarditis है. Rhythma या heart block जो दूसरा feature है of SLE, it was absent in that patient. How we have to see arrhythmia or heart block? With the help of ECG. Third is ischemic heart disease was absent in that patient because symptoms related to ischemic heart disease was absent. What are the symptoms? That is dyspnea, pale skin, burning chest, arrhythmia, pain, leg swelling, hypertension, and sweating. These all were absent. Fourth, lupus pneumonitis was absent. How we see lupus pneumonitis? Ground glass opacities are seen on chest x-ray, so that was not there. Shrinking lung syndrome was present. How we see? There is elevated hemidiaphragm which is present. If I am able to show you through this photo, can you see elevated diaphragm on this side? So this is shrinking lung syndrome. Okay. PAH and ARDS was absent. How we see that? Through PaO2 FiO2 ratio. Okay. Now renal manifestations in SLE patient. Minimal proteinuria. Yes, it was present. Microalbuminuria was there. Hematuria was absent. Nephrotic syndrome was absent. So UTI was absent. Another is chronic renal failure. So I have calculated GFR of that patient through Google. You can write on Google GFR calculator Click on the first link, one calculator will open. You have to just enter the values and they will calculate the GFR for you, and they will tell you which kidney disease is this, stage 1, 2, 3, 4, 5, like this. So GFR calculator I have did, so it was 128 ml per minute slash 1.73 m. So this was stage 1 kidney disease. Okay. Now neuro involvement is also there in SLE patient. I can tell you all the symptoms which should be there in SLE patient: cognitive dysfunction, convergence, depression, organic psychosis, central cranial nerve involvement, transverse myelitis, aseptic meningitis, migraine, chorea, cerebral ataxia, CVA, and peripheral neuropathy. But in my case, it was just the beginning of the disease, SLE, and all these symptoms come in the later stage of the disease when patient crosses her 40 to 50 years of age. So one should know that these symptoms are there in SLE, but because the patient which I was having was 17-year-old female, she was not having such symptoms. Telling you towards the investigation part, on blood examination, anemia was there only. Generally in SLE patient we see pancytopenia. What is pancytopenia, my dear friends? When there is anemia, when there is leukopenia, and when there is thrombocytopenia. ESR was raised. On urine analysis, proteinuria was present, hematuria was absent, rheumatoid factor was not positive, Coombs test was positive, blood urea and creatinine levels were high, and hypocomplementia was not there. Okay, see patchy alopecia. Are you able to observe? Hairs are absent. Coombs test was positive. So there are two Coombs tests. One is indirect Coombs test, other is direct Coombs test. So in my case, there was direct Coombs test which was positive. Okay. ANA, that is anti-nuclear antibody, that was also positive, and other antibodies which should be positive for SLE were also positive. On echo report, there was presence of pericardial effusion. Also the symptoms of pericardial effusion were present when we were thinking about pericarditis or myocarditis, which I have told you in cardiopulmonary involvement. ESR was raised. Now why ESR was raised? There are causes of raised ESR. The mnemonic is NAPKIN, NAPKIN. N stands for neoplasia, A stands for anemia, P stands for pregnancy, K stands for kidney disease, I stands for infection or inflammation, N stands for neoplasm. Okay, so due to infection, ESR was raised. Further, CPR was also raised. It was 53. So there is one criteria for raised or elevated CRP in SLE patient, that if the CRP is not changed or very little change, means less than 100, that means there is active SLE. Okay. RA factor was 10.99, which was less than 15, that means it is normal. Okay. Now on ultrasound report, there was grade 1 fatty liver with mild hepatomegaly, mild to moderate ascites, and mild bilateral pleural effusion. What is the management of this patient now? If mild is present, give glucocorticoids. If moderate SLE is there, then give prednisolone. If severe SLE is there, give prednisolone, cyclosporine, tacrolimus. If refractory SLE is there, give rituximab, belimumab, and IVIG. It was really interesting case for me because I really enjoyed studying on this case. If one studies near patient side, doing all tick cross of all the symptoms there, it is very easy to remember for future if same patients come. So I hope this case study which I have told you right now is beneficial for you, and that's all. I really enjoyed sharing this with you. I hope you have also enjoyed listening. Thanks. Dr. Muskaan signing off now.